Devin McGoldrick is the Director of Community Programs and Engagement Team at LIVESTRONG. In this role, Devin oversees national and community partnerships and designs programs and services to support people affected by cancer around the world. She has 12 years of experience in the healthcare field. Her expertise includes adolescent and young adult oncology, the development, implementation, and oversight of innovative projects and partnerships. Devin received her Master of Public Health from the Mailman School of Public Health at Columbia University. Joni is a Master's Prepared Certified Oncology Nurse. That's Joni Watson, is a Master's Prepared Certified Oncology Nurse. She is currently the Clinical Nurse Manager of Multidisciplinary Cancer Care Team at Shivers Cancer Center, part of the Seton Healthcare family in Central Texas. Prior to joining Seton, Joni was the Director of Nurse Oncology Education Program, a nonprofit project of the Texas Nurses Foundation, dedicated to ensuring all nurses are educated on cancer prevention, detection, treatment, and survivorship. Please join me as we welcome our speakers.
Thank you. I'm Devin McGoldrick, and as Ethan mentioned, I work here at LIVESTRONG, and it's my pleasure to be with all of you here tonight. Thank you. So as you probably saw in some of the promotional materials about the class, these are our learning objectives for tonight, and we hope that everyone, when you leave here, you'll have a better understanding of what we consider the young adult cancer burden. This is what are some of those disparities, how many young adults, and what are their experiences. And then also identifying the distinguishing characteristics of young adult survivors. What makes them different from other cancer survivors? What's really unique to this age group and this experience? And then also we want to provide a bunch of different resources for those of you in the room who are young adult survivors and for those of you who work with them. We want to make sure that you leave here knowing that while this age group does still lag behind with some specialty services, there are more and more resources out there to help, and we want to make sure that you all leave here knowing where to find them and knowing what some of those are. So we'll start off by sort of painting a picture of the current state of young adult oncology, and it's sort of, I always want to put an asterisk by that because, you know, it takes so long to get current scientific data, and it takes so long for the publishing to catch up with some of the numbers. So some of the numbers that we talk about are from several years ago, early 2000s, and so it's not exactly the current today's state, but it's the best picture of young adult oncology that we have. So first of all, the definition of an AYA patient, this usually, depending on the crowd, makes people feel really fantastic. So when we talk about AYA cancer patients or AYA cancer survivors, we're talking about anyone who's diagnosed with cancer between the ages of 15 and 39. And some people sort of criticize that age group and say that's too big, that's too broad. And we say not really. One, based on some of the shared experiences, that age group can have a lot in common. And two, I don't think that it's actually that developmentally more diverse than, say, 0 to 18, which is very commonly accepted as a pediatric age range. Every year in the U.S., there's approximately 68,000 young adults diagnosed with cancer. And I think the thing about that number that seems really shocking to me every time I think about it is that's about 8 times more than pediatric patients diagnosed. And that's not to diminish the pediatric burden, but I think it's just to shine a light on when you think about how much people maybe hear about or how much you see advocacy for pediatric cancers, and then you consider this is happening 8 times more often in this AYA age group, and people are not talking about it in the same way. And that's one of the things we'll get into a little bit more, is the sort of what is this building advocacy movement around this group of survivors. And then there are some disparities that we'll explore a little bit more that, again, I think sets this age group apart. Some of that is the cancer types and sites where we see the common cancers in this age group: breast cancer, cervical cancer, and then things that are not as, I think, sort of popular or big for, sarcomas, thyroid cancer, germ cell tumors, including testicular cancer. The other thing that we see, in which this graph demonstrates really well, and we'll talk through this, is the delays in the timing around the diagnosis and the impact that that has on survivorship. So what this graph shows, I'll talk you through it, is the y-axis is the average annual percentage change in 5-year survival rate. So between this year and that year, how much did the survival rate improve? And then the x-axis is the age at diagnosis. So what we've seen basically over time, and this is comparing from 1975 to 1997. So from 1975 to 1997, for this pediatric age group, we saw big improvements in average annual percentage change in 5-year survival rates, which makes a lot of sense. We started seeing big improvements in clinical trials, that building advocacy movement for pediatric cancers. We also see bigger leaps in survival for these older age groups. And again, a lot of that makes sense. You start to see some of those declines in people quitting smoking, mammography and cancer screening and prevention becoming more commonplace in practice. What we see here is, again, this age group, this AYA age group, really lagging behind. And in one case, you actually see it dip below the line. So what this is saying is that when they're not seeing, AYAs are not seeing the same improvements, and for that one little age group of 30 to 34, things are looking a little worse, which I think is pretty staggering to think that an AYA diagnosed today, or in this case in the late 90s, early 2000s, might be worse off than an AYA diagnosed in the 70s. That's pretty crazy to think about. And we want to talk about what are some of those things. And a lot of them speak to exactly the kind of disparities that we're talking about for this population. It's social and it's societal. What we see is that nowadays it's less common for a 30-year-old to maybe have steady health insurance or steady access to a family practitioner. In the 70s, I think you saw someone would get a job at something like GM or something and be there for life and have very steady health care, very steady access to health care, probably a family physician and things like that. That's not as common now. There's a lot of 30-year-olds sort of bouncing around and finding themselves or moving home or moving away and moving back and trying different things and not putting that same emphasis on that long-term access to health care. So in a nutshell, AYAs are very important to us. Our president and CEO, Doug Ullman, is a young adult cancer survivor. His family started a young adult foundation for young adults diagnosed with cancer when he was diagnosed in college and experienced, again, this dearth of resources for this age group. Also I think to bring it home locally, about 40% of the patients and clients served by LiveStrong's cancer navigation services, both in person and on the phone and online, about 40% of those clients are AYAs. And we hear from them about the same needs that we talk about here today, those same concerns: employment discrimination, being underinsured. How do I start dating after this? What about preserving my fertility? A lot of those same unique concerns. And so this is a top priority population for us personally, and we think in this Austin community. And part of that, again, is that they have historically, AYAs, and I'm sorry I keep saying they, like it's not us, we, them, us, all of us, AYAs, have historically not been recognized as a distinct population with unique needs. And we want to start treating AYAs like that and start recognizing and creating specialty services. Other interesting thing is this sort of funny juxtaposition of, especially towards the younger end of the AYA range, this funny sort of hink in the system: am I a peds or am I an adult? If you're 16, if you're 18, you're going to be a college freshman. Are you going to your pediatrician to get your college entry physical? Maybe. You're 21 and there's a funny swelling in your groin. Are you going back to sit in that waiting room that has like the puzzles and the highlights for children magazine? Maybe not. But then where are you going? Who are you talking to about your health? It's really hard to say. And what we see a lot of times too is, so you get an 18-year-old diagnosed with colon cancer, an adult oncologist might freak out and not know exactly how to treat you or what to do with you. And what we see as a result is not really a great sense of belonging anywhere in the healthcare system, which often which then might translate into multiple referrals around the system. And again, we get back to that delayed diagnosis, all these barriers with health insurance and different things like that. And as a result of all of these different things, and things we'll explore a little bit more, we've seen AYA patients falling through the cracks. And again, we believe this is what's contributing to some of these lagging survival rates. And this general feeling of sort of being unsupported and being out there and there's no one like me. So what we want to talk about today is a little bit more about what this young adult experience is like, and then again, we'll circle back to things that do exist and ways to help.
Okay. Thanks so much, Devin, for providing that overview. Hopefully my microphone won't slide off the table here, but if it does, we'll just go with it, right? So what I really want to talk about during my part of the presentation is, 5 to 10 years ago, people weren't really talking about the adolescent and young adult population. Like Devin was saying, the AYA population really hasn't seen advances in survival rates in the last 3 decades. And I really think that this topic and this population has been brought to light by so many advocacy organizations, with LiveStrong really forging the way. They were one of the first organizations to really say, hey, wait a second, this is a unique group of patients with unique cancers, that cancers actually function differently biologically. We don't have studies about them. They're not enrolled in clinical trials. They don't have access to health insurance like their other cancer cohorts or the other cancer populations do. And so we need to do something about that. And so I really thank LiveStrong for partnering with other organizations, not just advocacy organizations, but healthcare professional organizations as well, and policy organizations, to really focus in on this group from very different angles. And so within the last 5 to 10 years, this population is just now being recognized by healthcare professionals as a distinct population with unique challenges, issues, lessons that we can learn from them. And like Devin was saying, AYAs are really positioned at the intersection of pediatric and adult oncology. And that results in some, awkward moments as healthcare professionals, not knowing, a handoff. Who's going to take care of this patient? And we haven't been really good historically about communicating, okay, the pediatrician's going to take care of this, the adult oncologist is going to take care of this. So it's really nice that it's starting to come to light. And so healthcare professionals' knowledge gaps results in patients falling through the cracks, like Devin said, with not only their care, but supportive care resources as well. And we definitely don't want that to happen. So we're realizing as healthcare professionals that our complacency, that our own knowledge gap has perpetuated, it's continued these gaps in care and these gaps in survival. And that's nothing that healthcare professionals want, because it's a population that we're caring for and providing for. Our adolescent and young adult cancer survivors are really trying to integrate back into society. They're trying to lead normal lives as much as possible, and they're managing unique challenges and issues as a direct and indirect result of their cancer, but also the treatments that we're using for their cancers. And we have to remember that AYAs face unique physical, emotional, and practical concerns, and these concerns are not often concerns that other cancer survivors encounter, and they're concerns that not other adolescent and young adults without cancer encounter either. So over the next few slides that I'm going to present, I hope to share with you some stories of adolescent and young adult cancer survivors. I know we have AYA survivors in the room tonight. I know they're joining us online. But I also know that there are lots of providers here as well. Providers are joining us online too. We have advocates in the room and advocates online. And so while I feel like I might be preaching to the choir, so to speak, on some of these issues, there are people that this is new to them. And so I want to make sure that we provide a foundational level of knowledge for them as well, so that they can help take this message and advocate for AYAs out in their communities too. So this slide I want to start off with, I mentioned the gap in healthcare knowledge about adolescent and young adult cancer. I'm an oncology nurse. As Ethan mentioned, I was previously the director of an organization called the Nurse Oncology Education Program. We call it NOEP for short. And NOEP provides continuing education to nurses in all fields of practice on cancer prevention, detection, treatment, and survivorship, because every single nurse can fight cancer, not just oncology nurses. You encounter nurses getting a colonoscopy, or you see a nurse in pre-op, you see a nurse in your OB-GYN's office, and so all of those nurses need to be aware of unique physical, emotional, and practical concerns of AYAs, and they can impact cancer prevention, detection, treatment, and survivorship as well. And so LiveStrong and NOEP partner together to provide continuing education to nurses in all fields of practice across the U.S. on AYA cancer survivorship to really impact this gap. And before they did, they wanted to make sure that our efforts were on par. We want to make sure first there is a knowledge gap, because we want to make sure that we can evaluate our efforts and make sure that knowledge gap is closing. And we want to make sure that we're focusing our efforts on the right things. So what is it that nurses need to know about AYA cancer survivorship? And they sent out surveys to nurses all across the United States. They got 961 surveys back, and these are some of the results that were revealed in those surveys. The things that really stand out to me is, number one, 92% of nurses really didn't even know what an AYA is. Who is that population? I think that most people said it's someone between the ages of 13 to 25, and left out a whole group of people in this population with similar concerns and needs that professionals need to be aware of. And then 97% reported they needed additional training on AYA cancer survivorship. So when you have 97% of nurses responding and saying, we really don't know about these things, we need to learn, I think that speaks to a much larger gap in healthcare knowledge. Now, NOAP only surveyed nurses. We don't have similar data on physicians, but it's probably very similar as well. And so in partnership, NOAP and LiveStrong created a continuing nursing education video series called At the Crossroads, Cancer in Ages 15 to 39. It is free on the NOAP website, noep.org. I encourage you to share it with your own nurses, with your own physician, social worker, your entire healthcare team, because it's not only for nurses, but it is free and it is a resource for sure. And I'll share some of those videos coming up. So a 2012 study in the journal Cancer showed that AYA cancer survivors have worse health and unhealthier behaviors than people without a history of cancer. In general, they smoke more and exercise less, have a higher percentage of chronic medical conditions and obesity, have poor mental and physical health, and experience more financial burdens to medical care access than people who have not had cancer. That's a lot for one population. And those are in generalities from a very large study. It appeared in the 2012, I want to say it was the May issue in the Cancer Journal. So I have that reference if you would like it. But we've definitely identified specific areas that need attention, not just from healthcare professionals, but from advocates as well, and policymakers, everyone involved in this. They are physical, emotional, and practical issues, and that's how I will talk about them tonight. But what we don't get from statistics and literature searches is the voice of the patient, the actual, immeasurable, unquantifiable, in their own words voice. I am not a cancer survivor myself. As I mentioned, I'm an oncology nurse. I'm very passionate about AYA oncology and improving cancer survivorship for this population. So over the next few slides, I want to share with you in survivors' own words what some of these issues practically and logistically look like in real life. So the first one is Becca Babcock, and this is a conversation between her and a gentleman by the name of Lynn Lane. Lynn is the founder of an organization called Voices of Survivors. He is a prostate cancer survivor himself and was diagnosed as a young adult. And he is having a very intimate conversation with Becca and with her permission. And so I want to just listen in to some of the things that Becca says for a little bit.
When we talked before, you were saying that there's a film project going on, and part of the film project is really giving people an idea of what it is to be a chronic patient. So, what's that like, and what are you really trying to get across in this film?
Well, the film is tentatively titled "I'm a Visitor in Your World," and it's actually based off of a blog entry that I wrote a couple months back, and basically it started stemming from my world as I see it now has completely changed. And I'm 29. I see all of my friends around me doing the things that 29-year-olds should be doing, which is starting families and buying homes and moving and furthering their career, whereas I was starting to feel pretty stagnant. I was feeling kind of like I was delegated to this limbo of just sort of here on treatment indefinitely and doing things that nobody my age should really ever have to even think about. I go on about life. I go to work and I go out with friends and I go to family events, and I live my life as, to the outside observer, as normal. And I kind of pride myself on the fact that if you didn't know me very well, you probably wouldn't know that I'm constantly on chemo, and that I've had all this stuff. And I kind of pride myself on that to a degree. I really enjoyed sort of the idea that I'm not your typical cancer patient. When I thought of cancer before I was ever diagnosed, I thought of little bald kids with no eyebrows, and I'm not that, and I kind of like that. But after a while, it started to get to me that it felt fake. I felt like I was going through the motions of being a normal person, which is nothing to do with being a patient, and being a chronic patient. And, every day doing something dealing with cancer, whether it's taking my chemo pills or, going in for blood tests or going in for treatments or trying to figure out why my side effects are, making me lose all the weight and my hair is falling. I felt there was a big shift, a big dichotomy. I felt like I was living one world and experiencing another sort of superficially. So I wanted to get out there. I wanted people to realize that even though you might see me and other patients, I know a lot of people like me, young people who are going through, the motions, and even though you might see me and think that I'm doing really well, or, if you know my story, you might look at me and be kind of inspired or whatever, that I'm tend to be living my life and doing well. I wanted to sort of get out there that no, actually it never leaves me. You might see me out at a party and I might look like I'm, carefree and having a good time, but it takes a lot of work for me to get to that point where, always in the back of my mind, cancer is always there, regardless of how far away from it I get, which I'm not very far away from it right now. I'm doing treatment every week, but regardless of where in my life I am and where cancer is, it's always a very heavy influence on everything that I do. It's just always there. There's this nagging thing that makes me feel a bit like an alien in this world. I feel like I get to look at everybody else and be jealous of, how mundane some people live their lives. I would love to be mundane and just plain Jane. I would love to never, ever have to talk about the fact that I have a hole in my stomach that I stick a tube in 4 times a day and, poop comes out. Like, that's not something that you want to talk about ever, let alone when you're young and, trying to get your life situated. And I felt like I never was there's a difference in very, very young cancer patients, kids and children's teens, and very old cancer patients, people who are, over the age of 65, 75, and young adults. There's a huge shift because I feel like in young children, you have your cancer, you have your family to support, your parents to support, you don't necessarily go through it all alone. You're very well supported. When you're older, generally you have your own family. You have, a spouse or kids or what have you. I'm in this young, single, trying to find my career kind of place where I had just graduated college when I was diagnosed, and it completely halted everything for me. I graduated college with a degree in interactive multimedia, never once got to work in interactive multimedia. Like I never even got away from the part-time job that I was working to get through college, which I still am at, which I love to death. I love my job and I love where I work, but it's not what I was trying to do for a career. And it just never happened because being a patient takes up a good, maybe 75, maybe 95% of my day, where I can't focus on other things in life. I have to, being a patient is practically a full-time job.
Being a patient is practically a full-time job. It's so true. I mean, I work in a busy clinic, and I focus on a team that helps to try and coordinate care for patients. And all of the appointments that patients have to make, lab tests, physical rehab, you have 3 or 4 physicians. You have a dentist too, things like that. It just takes up, everything, every part of adolescent and young adults' lives. And we often forget, especially healthcare professionals, that AYAs often, they also have their other life on top of this. Being a cancer patient is not their life. They have work, they have school, they're trying to climb the ladder, they're trying to find their life partner, they want to have children. They're focusing on all of these other things, and their cancer is part of it too. And they're going through all of these emotional concerns as well. Facing your own mortality, that's big. That takes a lot of effort to think about things like that. And so healthcare professionals, we're really good at forgetting those things. And so I hope that healthcare professionals here and online remember Becca's words, that it often feels like a full-time job, and keep that in your mind as well. So one of the things that I want to mention in regards to physical issues is that AYA cancer acts biologically different than other cancers. It physically acts different. And we don't really know why that is. Adolescents and young adults have lower enrollment in clinical trials. And so it's difficult for us to really understand the mechanisms of how cancer works when AYAs aren't involved in clinical trials. So that's an important advocacy step that we need to try and push forward as a group, is to make sure that healthcare professionals know, our policymakers know, our adolescent and young adult cancer patients know. Clinical trials should be presented as a first-line option with everything else when it comes to a cancer treatment. Those are recommended guidelines from the National Comprehensive Cancer Network. And AYA's physical issues might be just for the moment during their treatment, but they might also have late and long-term effects. So these physical issues may be with them for the rest of their lives. Becca talked about a colostomy. Those can be temporary, they can be permanent. And so we need to consider and think about physical issues are not just for the moment of diagnosis. They're not just for the moment of treatment. They can be long-term survivorship issues, which are often cared for outside of an oncology setting. So 3, 5, 6 years down the line, when treatment is finished and surveillance is over from the oncologist, it's a primary care provider that's taking care of a lot of those things. Primary care providers, primary care nurses need to know about these survivorship issues for AYAs as well. Emotional issues are huge for AYAs. One of the things that I hear over and over again is fear. Fear of recurrence, fear of loss, fear of death. Fear is a common theme for adolescents and young adults. And they often feel like they can't move forward because there's uncertainty in the plan. And that's troubling because AYAs are at a pivotal role developmentally. As I mentioned before, they're focusing on school, getting out of school, finding a career, going through all of those major developmental milestones that other AYAs are. And so, I got out of school, I had a 5-year plan. I'm going to have this, 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 and this, and by the time I'm 30, this is where I'm going to be in my career. Well, other AYAs do too, and suddenly all of those plans halt, and it's hard to plan forward based on uncertainty. And so AYAs' lives become focused on finding meaning and setting priorities and not being able to live invincibly. And so their life becomes very different from their AYA peers, which can also cause some anxiety and loss in relationships with others as well, because friends may not understand what their friend is going through. Becca said that she really prided herself on her friends and other people not knowing about her cancer diagnosis. But then she had some loneliness and felt alone because no one really knew. And so those emotional issues can be from the survivor themselves, or they can be external from friends who, this happens a lot too, that say, I'm not really sure what to do, what to say, how to act. And so they step out of that relationship. Again, another loss for AYAs. And so, AYAs, the theme that I hear over and over again is loss of invincibility, loss of relationships. And so we as healthcare professionals and advocates can really help close those gaps and make those losses much smaller and walk alongside them. One of the best things that healthcare professionals can do for AYAs is ensure that they have age-appropriate support systems for them so that they know that they're not alone. You know, I've heard from 25-year-old men who've said, you know, I've sat in the pediatric waiting room with clowns painted on the wall, and I felt alone. I was the oldest person in there. Or, you know, the 18-year-old who sat in the adult oncology waiting room, who was the youngest person in there. You know, age-wise, they're physically separated from other populations, and so it's important that we provide age-appropriate, age-relevant resources to this population, because AYAs are not alone in this. As Devin said, a cancer diagnosis in AYAs is 15 times more likely than in the pediatric population. So there's no reason that we as healthcare professionals or advocates should have to let another AYA go through this journey alone. And so I want to show you another video. This is actually from the At the Crossroads video series that Know Up and Live Strong created together. Again, it's free of charge. And this is talking about some of the unique emotional needs within the AYA population.
I didn't know anyone that was my age having cancer.
When I told like my closest friends, they were like, oh, you know, I'm sorry. Like they didn't know what to say.
Because I didn't want people to treat me different, and so I didn't want everybody knowing.
As nurses, oftentimes we forget that developmental issues are important for every single age.
There are providers who, you know, if you did a pretest, would say to me, there's no difference in how I treat a 20-year-old and a 60-year-old. And then I'll start naming off issues and data.
When I got sick, I mean, the idea was that at this point we should have kids, you know. And I got sick right when that was supposed to happen.
For someone that's used to working 12 or 14 hours a day, suddenly doing nothing was really hard.
I've always been an independent person.
She'd just become a CPA, was working a lot of hours. Her career was just taking off.
When you're younger, it's supposed to be this, you control your destiny, you can do anything.
I felt like I had lost 200% control of myself.
How can you tell me that giving a fertility impairing drug to a 20-year-old who hasn't had children and hasn't had the opportunity to have children is the same as giving that drug to a 60-year-old? How can you tell me that it's the same to treat a 25-year-old who's been on the job for 3 months and is worried about whether 2 months of therapy and all the sick leave is going to impact their ability to climb the ladder, then giving that same therapy to a 55-year-old who's going in for the gold watch in a few years, and the whole community is like, oh, take whatever time you need, we'll be supportive and we'll get so-and-so to cover you.
And that's one thing, we were always in control. We're self-sufficient.
Yeah.
We're both full-time students, and that was about halfway through term. I don't know what's coming next. I've never known anybody with leukemia.
One of the things we hear young adults say often is that they just felt so isolated going through the experience.
In the beginning, it seems so unlikely that you're ever going to feel normal again. Friends and family want to understand, but they may not be in the hospital. They may not see the person when they're getting their treatments.
And all the videos were all tailored towards like older people. I mean, we noticed that right away, and I'm making fun of it because it's like, this is kind of hokey, you know? It's like, it has nothing to do with it. These people aren't going through it. I'm going through it all.
There's a role that I can provide as a member of their larger care team to be age appropriate, to smile, to ask them about their day, to talk to them about things that I would want my friends to talk to me about.
We'll go paintballing with Haven in a few days.
I always try to make sure I know, when their proms are, when their important sports events are, what sports teams they like, what music they like. Let them know that I think of them as a person going through something horrible, not as just, a patient.
I know that there's not a perfect way to deal with someone who's been with cancer, but there are certainly things that are hurtful.
Young adults have such different issues. They're at a transitional developmental stage in life where they're struggling for independence, start families, start careers, and then they're given a cancer diagnosis that puts them back. Jason and Jessica came to the group, and their story was just so amazing. Would you guys like to start today and introduce? Within months of each other, both of them were diagnosed with a cancer.
I was in a new job, trying to work long hours so I could be with her when she was in the hospital. After I was diagnosed, I had surgery, and about a month after I was back to work, they fired me. Said you weren't performing very well.
We're going to OHSU Center for Health and Healing for me to get my CT scan and blood work done that I get done every 3 months. It's really hard to work around all these scheduling of appointments. It was hard because there wasn't a lot of understanding about the fact that I had to miss work. I even had people say to me, "Your cancer has been so hard on me."
Some people stuck around for maybe a year or two, and a lot of people just took off. I think it just got scared, couldn't deal with it.
But I was really in love with my boyfriend, who's in my band, we're best friends. And it just shook us. And I knew he wouldn't leave because I was the girl that needed, the woman that needed help. We were fighting one night, and I just said, "Get out."
You may see someone who, in your clinic, comes across as being a very self-confident, outgoing individual, but then when you talk to them about what they do for fun, what do they have in the way of relationships with peers and friends and partner relationships, they may be very limited.
When I shaved my head, a lot of people thought it was because I had joined the military, and a lot of other people were just joking around, "Oh, it's cancer boy," but they didn't know that I had cancer.
It can be pretty devastating to find out you're not invincible, that this is hitting at a developmental kind of place and time where you're really not supposed to be told you have a life-threatening illness.
Being able to build support systems that involve other young adults is really critical.
I'd go to the store and I'd see people our age living regular lives, and I'd be like, I remember when we lived regular lives. Because one of the things that I remember, I was like, I just wish one day we'll be able to walk hand in hand again, and I just really had hoped that that would happen. It was a wheelchair for a long time, and then it was a walker, and then it was a cane, and it was like, you could see the progression building and building. It was like, this is really exciting. The day that it happened was, it was really amazing because I just didn't know if it would happen again. So now every time we get to, I really do appreciate it. It means a whole lot to be able to do that. And
thank you. Thank you so much.
One
day we'll run side by side.
There we go. Or skipping. Skipping's harder for you.
Skipping's supposed to be exhausting for me.
We've talked about physical concerns and emotional concerns, and now I want to talk a little bit about practical concerns, which can often be, just the icing on the cake, so to speak. So much more difficult than some of the physical and emotional concerns because, again, of the developmental stage of adolescents and young adults. The first thing is difficult communicating with the healthcare team. People ages 18 to 39 are not typically the best self-advocates. Developmentally speaking, pediatrics have their parents to be their advocates for them, to talk to physicians, to sort of push the envelope and ask those tough questions and get care. The older population, 40 and above, they've been through life circumstances to sort of make them their own self-advocate as well. But 18 to 39, we really see that they don't self-advocate very well. And so healthcare professionals really need to be aware, as do advocates of AYAs, family members of AYAs, and really help encourage that on. Write down questions, ask your healthcare providers, know what's going on, be your own advocate when it comes to your health, because you know your body the best. And so if you tell someone that something's not right, someone should stop and listen to you. And if they don't, you need to tell them again and be an advocate for your own health. And also too, I'm in this age group, adolescents and young adults aren't very communicative. You know, typically when I go to the doctor, you know, I'm a nurse, I will say, you know, this is what's going on, and that's it. You know, I even have difficulty asking questions and answering to the full extent, or being comfortable with other healthcare providers. And so it's important for healthcare providers to ask direct questions and to ask open-ended questions to get full stories from adolescents and young adults. Delayed diagnosis is a huge practical issue for AYAs. And this has a lot to do with, again, providers' knowledge gap. You know, we continue on the gap because we don't know, we may not recognize signs and symptoms of cancer, or we think, you're too young to have cancer. Adolescents and young adults themselves might, you know, brush it off themselves. You know, I've had a sore throat for 6 months now, but I'm continuing to take Robitussin and cough drops, and it'll go away on its own. I really don't need to get it checked out. But inadequate access to care and lack of health insurance are huge for this age group. The AYA population is the largest uninsured population in the United States currently. And if you don't have insurance, you're not going to go get your preventive care, pap smears, those sorts of things. If you don't have insurance, you're probably not going to go see a doctor if you have a mild case of something going on. You know, like I said, we'll brush it off, it'll get better, and it just goes on and on and on until you absolutely have to go to the emergency room, or somebody else says, you know what, that is not right. You need to go see a doctor. Let's go. So insurance makes a tremendous impact on adolescents and young adults in their care. But there is hope in this area, I will tell you, that from September 2010 to December 2011, 3.1 million young adults have obtained insurance coverage as a result of the Patient Protection and Affordable Care Act, which now requires insurers to allow adults to stay on family policies until the age of 26. 3.1 million adolescents and young adults have insurance because of the Affordable Care Act, and that number is growing every day. That's great news for this population because they have access to care. Other practical issues, you know, working, employment discrimination. As the gentleman was saying that, you know, he got fired because he wasn't performing well. You know, that's discrimination and that's illegal. Financial stress. A cancer diagnosis is a common cause of bankruptcy. It is financially, it is such a barrier, and I see it every single day. It can devastate patients and families, which can then again impact other issues as well. If you don't want to, you know, if you're having to choose between rent and groceries and medicines, you know, those sorts of things, or you have, you know, a stack of bills just piling up and piling up and piling up, and healthcare providers might be saying, you know what, don't worry about those bills for right now. They'll still be there. And of course, you know, I hear healthcare professionals say this all the time, but that doesn't eliminate the worry from adolescents and young adults from having to pay for it or having to think, you know, great, I'm going to finish my treatment and then I'm going to have $90,000 in medical debt to pay off. And so, you know, one of the things that I want to tell you and make sure that other healthcare professionals remember is that we are whole people, mind, body, and soul. And even though we've distinctly talked about physical, emotional, and practical concerns, these concerns are all related to one another. And so, for example, a physical concern like sexual dysfunction can lead to emotional concerns of body image, fear, anxiety. A physical concern of fatigue can impact a practical concern like employability. I'm too tired to go to work. I can't do my job like I used to. So even though we've sort of siloed out these things to talk about them, remember that they're all connected to one another. And this is the last video clip that I'm going to show. It talks about specific access to care issues. And I think I've covered on all of these.
for the AYA patient really becomes quite complex.
As far as we know, we're the first married couple on the pediatric record side. There have been many times where I've called the pediatric side to make an appointment or have a refill on a prescription, and they'd be like, "And how old is your son?"
Sometimes we don't know what to do. You have a 17-year-old diagnosed with cancer. Who treats that child? Is that child or adult? You know, it's kind of hard to even to say, are they a child or an adult, and are they treated in the pediatric hospital or in the adult hospital?
Each patient is individual, and 18 is not 18. There are 18-year-olds who live at home and really need their mother and would be best in a paternalistic pediatric setting. And there are 18-year-olds who are married and are independent in their decision making and their economics and would really be best in an adult setting. You add in the factors of where their expertise is in their disease, the data on the impact of how you're treated changing your outcome is one of those aha moments for people.
There are certainly cancer emergencies where we need to start right away, but there are, I think, other circumstances that we're learning it's probably more appropriate to slow down a little bit and take time to do things like investigate whether there's clinical trial opportunities, get a few more opinions, maybe a little crosstalk between the adult side and the pediatric side.
It was a coordinated effort where I was seeing gastroenterologists, surgeons, oncologists, the fertility doctors.
I think that people need to see that as the model, that collaborating is the way to go, not keeping patients to yourself.
As a general rule, young adults with cancer tend to be otherwise healthy and often have a situation where with aggressive care they can be cured. And so we will sometimes be willing to take a much riskier approach for a young adult than we might for, say, an older adult.
So we need to really be thoughtful about each individual and say, what's the best way that we can help save this person's life and then help them have a long, productive, happy life.
Initially, when I was told, oh, you might have cancer, the first thought was, I don't have insurance.
The adolescent and young adult population is the most underinsured population in the United States.
I did not have health insurance.
People our age have a lot of issues with that, especially if they get sick, because they haven't established themselves.
They don't have it through a job yet, and they don't expect they need it.
There's some research that shows if you're underinsured, if you have public insurance or no insurance, there's a significant delay in diagnosis. And delay in diagnosis sometimes can lead to worse outcomes.
I was emotionally distraught only because I said, well, I know that's a lot of money ahead of me.
Raising 3 children and paying for my share of my health care has been a real struggle for us.
Once the diagnosis has been made, I think that the main role of the nurse is to kind of provide some emotional support, because obviously most patients and families are going to be in a state of shock. It's helpful for patients to have a little bit of preparation, knowing, okay, you're going to probably be in the hospital for a week, rather than them in their head sometimes thinking, oh, I just have to go spend the night and do some more tests and then I'll be able to go home.
And connecting them up with different people that, a social worker or different members of the care team that they'll meet and say, we're here for you, we're going to support you around this.
It's really important to me that I know who you are and who you are prior to your cancer diagnosis. As a social worker, I'm kind of charged with all the non-medical issues that our patients experience. That could be adjustment to their diagnosis, loss of work or income, applying for Social Security disability, understanding how this big hospital system works. This is so much information that we're giving you all at once.
And we've only been here since Monday morning we checked in, but you've answered more questions probably than any of the doctors have.
My mom's the only one working right now, and my dad is the one that helps me and takes care of me when I'm up here. Oh God, it's so expensive to have cancer.
Right now I'm taking chemotherapy. So far I've had 4 chemos since August, and I have 2 more to go. With me not being able to work, that's the biggest part of my worry. Plus being a single dad and trying to be strong for my daughter also, that's a big load. It's a really scary place to be. It's a lot of nights I sit and cry. I mean, ever since this leukemia, I mean, I'm so emotional, thinking that I'm finna leave her alone by herself. Yeah.
And are you depressed?
Yeah.
Which is normal.
Yeah,
I
that's,
know.
yeah, that's.
I think one of the key things is for young adults to understand they're not alone, because I think the folks who do the best are people who can support sort of their emotional health just as much as their physical health. I don't know if do you know about 211?
I think the most important thing for any oncologist that really wants to address the needs of AYA patients is just to know what resources are out there and to make sure that we're doing the best for the patient.
These videos, but for anyone who is a nurse, for anyone who knows a nurse, for anyone who goes to the doctor and sees a nurse, these are online. They're all free, and they offer continuing nursing education credits that all practicing nurses need. And we think they're just, I think, have a real potential to move the needle in this field, and I think get people thinking differently. So we're going to do one more video for the night, and this one I think allows us to dive a little deeper into the stories of 4 survivors. So I did a project where I got to travel to a couple different college campuses across the U.S. a few years ago and meet with 4 different survivors who were all college students. And we spent several days with them, and we were able to really see and hear from them and get to know and what's their experience like. And I think that they paint you this really vivid picture of all the things that we've been saying, from the delays in diagnosis that they experienced to all of these, again, as Joni said, this holistic experience where your practical and your emotional and your physical experiences and issues are so intertwined, it's defining their current experience through treatment and then also post-treatment.
I lost most of my friends. I thought the best way to protect my friends and my family were to keep them away.
It wasn't adding up. I had trained all summer long for this, and I just couldn't do it.
I worked so hard just trying to get scholarships for football and just trying to get ready for college, and then life throws you a curveball.
It was definitely a lonely experience in high school, and there aren't very many resources for young adults.
I came to East Carolina on a soccer scholarship. Everything was going great, but there was one fitness test that I couldn't pass. You do it every week until you do pass, and I just wasn't getting any better, and I wasn't passing.
I mean, it doesn't make sense. Like running up a hill, couldn't do that. Like if I went up a flight of stairs, after I got done, I just had to stop.
And then I started to get frustrated, and so I stopped playing soccer. I think it was hard for my mom because she didn't understand how something that was such a big part of my life, how I just let it go. 2 years later, I got really bad pneumonia and went to the Student Health Center. They did a chest x-ray and they said that it was just pneumonia, not to worry. There was a spot, but he was sure that it would clear up.
One night, we were playing football and my side just started hurting really bad. And I was like, Coach, my side over here, buddy. He was like, I don't care. So I played. And then halftime, I was like, Coach, I can't go anymore. And he said, well, take your shoulder pads off. You were out for this game and for the rest of the season. I was like, okay, that's fine. Whatever. I mean, I was mad. So one of my parents were just like, we have to go to the hospital. And something's just not right. I don't feel right. So the doctors came in and just straight up said, you have cancer. I'm not sure what type yet, but you have it. I'm just sitting there like, wow, here's everything, you know.
You work your whole life for something, and it's basically like a huge letdown. I feel like I let down my teammates and my coach.
Cancer in my age group is kind of overlooked.
You're not an age where they scan you or expect you to have cancer.
It's something that adolescents think that they are immune to.
I had so much stuff to do, especially back then. I was on the cycling team, I fenced, I worked. I'm not willing to shift my schedules for people that much, especially my health, because I didn't really think it was that important. And then all of a sudden I had like the permanent flu and no one knew what was wrong with me.
I started with flu-like symptoms and a deep rattling cough. I was taking antibiotics for a while, and then the symptoms would go away and then they would come back. I was studying one night and then I reached up and scratched my neck and there was a big lump. So I woke up my dad, and he is actually a doctor himself, so he kind of knew right away what was wrong.
I'm a physics major and a geology major. My sorority is Phi Sigma Rho. It's the engineering sorority on campus.
Kristen is my big sister in the sorority. Kristen is... She hates this word, strong. I'd known she was going in for some testing, so I knew she was expecting these results like within the next few days.
My doctor knows I'm really busy all the time, so I knew regardless of whatever the news was, he'd call me at work. When he told me, he's like, well, we think it's non-Hodgkin's lymphoma, like you have a tumor, it's most likely benign. I didn't cry at all. I almost laughed at him because I thought it was a huge joke.
So she just sent me this text message on like I am or something, and I'm like, what? And I think for a second it was just like utter shock.
From the time I first felt the lump to my first chemo treatment was a period of about 5 days. The only thing I was thinking about initially was school and what would happen with school. A lot of stuff was going on. The college process had begun. I had been ready for the next step.
When your best friend is 23, 24, you don't expect her to get cancer.
Just personally, I think of cancer as being like just older people getting it.
I don't think a lot of people my age really think about it.
We don't want to think about it, I think. We just kind of want to go easy breezy in life.
You know, if I don't know I have it, then I don't have it.
You can get cancer at any age. It's just not old people or older people.
At a young age, when kids are feeling their freedom, to have something that threatens you with your mortality, it throws them out of sync with their peers, and they're confronting issues that just don't belong in young adulthood.
When I hear cancer, I hear death.
Death and dying.
Death.
Mortality.
Deadly. Death.
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 Scary.
You didn't run out on me when I got sick. Sean didn't run out on me. That was about it, though. I really felt really isolated. People stare at you, and they wonder, why doesn't she have hair? Oh, she has cancer. Let's not talk to her.
There was a lot of my close sorority sisters that didn't even come to the hospital. Not because they didn't want to, but I just think that they were just overwhelmed. I mean, when you're a college student and you're 20 years old, like, you don't know how to deal with that kind of stuff.
Hi.
Hey, Kristen, how are you?
Good, how are you?
Good. So how did things go in your classes today?
Well, geology...
I don't think young adults have it in their brain to think about cancer or any illness. My experience in development with young adults is they're questioning everything, and all of a sudden to kind of have this thing put on their lap to negotiate is huge. It's scary to negotiate the medical community when you're away from home and support people, and we're a natural place to plug in.
I'm a very independent woman. That's why I think I kept everyone away. I wouldn't tell them that I needed people to go grocery shopping for me. I wouldn't tell them that I needed someone to just sit with me sometimes and not feel so alone and by myself. My parents desperately wanted to be with me, and I didn't let them at all. I kept them at arm's length the entire time. I wanted them to be in blissful ignorance and think of my cheerful phone calls all the time and say, yeah, I'm fine, Mom, I feel great. It was the first time in my life that I was really not honest with my parents. I didn't want them to see what I looked like. I didn't want them to see me throwing up all the time. I didn't want them to see me like passing out. My oncologist had told me you should write letters to your family and friends, like saying goodbye in case something happens.
His birthday is November 3rd, 1989. He's having a contact with Mr. 15
The first visitor that was non-family related was the offensive coordinator and the head football coach. First words they said were, "I'm sorry. We're sorry for everything that we've said to you the past few weeks, the past month or whatever. We're sorry."
When you think of 21 years old or 20 years old, healthy college athlete, and non-smoker, you don't ever think lung cancer. Once I finally was diagnosed, my doctor looked at me and he said, "Taylor, I'm assuming that you haven't been feeling quite right for a couple of years now." And that's when it like all hit me, and I looked at my mom and I said, "Mom, I told you." Because like I just couldn't put my finger on it. I just knew something wasn't right, but I couldn't figure out what it was. I think that had a little bit to do with how it was missed. If somebody had thought a little bit outside of the box, it might have saved my lung. After I was diagnosed with lung cancer, my mom pulled all of my medical records from student health and sports medicine, and they found that on the radiologist report it had said further follow-up is needed, but no one ever told me that. It kind of makes me mad, because I mean I could potentially still be playing soccer.
One of the challenges for anyone dealing with cancer is, does this change who I am, and how does it change it? And as young adults are just beginning to solidify what that is, they're thinking about career, it's important to get at who's the substance of who they are, and cancer doesn't have to change that.
A lot of times, telling stories is an outlet for trauma, but people have this assumption that I would never want to talk about it.
When anyone just says cancer, you immediately think, "Oh God, I'm gonna die." You get good doctors and good support group and good everything you just learn, you'll be okay.
I think students, when they have life-changing events, they go to a place where they can ask the big questions. I've offered with Kristen and with others, I'll just go up to the hospital with you. I'll just sit, I'll bring a book, just so you know you're not alone.
It is impossible for us not to speak about what we have seen and heard. So
What I think is rewarding is to watch her begin to trust and tell more of the story.
Like, it might not be as big as cancer. It might be a little thing like you had a really bad week. We should tell people about the graces that we've received, both good and bad.
She describes the medication as having the seeds of life. Right. Yeah. At Brown, I teach medical students and undergraduate students about the impact of cancer on patients' lives. It's kind of an ongoing job to reiterate and reteach the importance of the psychosocial issues.
Through your treatment, what keeps you going is a sense of the future. Because of this illness, I did decide to apply to the medical program at Brown and explore medicine. As of now, I want to be an oncologist. Sometimes I feel like we could use more doctors who were less science people, because there's another dimension that is added when you're not just like buried in your biology textbooks.
Every day, I'm reminded of the core of what really matters in life, because I see people struggling with life and death, and in most instances, they prevail and they overcome the disease, and they have a good sense of what really matters.
If I was to come face to face with cancer and say something to that, sometimes I do think I'd be like, "Thank you." Because you just learn. I mean, I became grateful for my life. Like before, I would just go out and do whatever I wanted to and just didn't care. And then like now you just kind of think, wow, it's a good day. Like, I mean, it's raining, who cares? It's a great day. At least I woke up to see it.
Center, and they can connect you to all of these and then additional ones. Practical. So we bucketed these sort of the same way we talked about some of the things in the video. These practical needs. I have no money. What do I do? I want to go to school. What do I do? I think I'm being discriminated against in my workplace. Here are some people who can help specifically. This CCCpedia is one clearinghouse of a lot of great scholarships and financial assistance information. The Cancer Legal Resource Center is a joint program of the Disability Rights Legal Center and Loyola Law School, and they offer free and confidential information and resources on cancer-related legal issues. They're amazing. And then grants. So in addition to scholarships, which sometimes have restrictions or some, about tuition or books and things like that, there's a couple organizations, and one in particular, the SAM Fund, SAMFUND, and it's run by a young adult survivor, Samantha Eisenstein. Oh, she's married, Watson, I think. But they offer individual cash stipends for things like my heat is getting turned off. I cannot make my car payment. They do small dollar amount cash stipends, and I do think that she has sort of an application period or maybe 2 a year. But all the information is on the website. Physical, some of these unique physical needs of this age group, again, as we talked about, the fertility preservation needs and concerns of AYAs are unique to someone who is maybe past childbearing age or where the decision is being made for them by a parent. The fertility information and services, including our Sharing Hope program, is offered through the LiveStrong Navigation Services. It's an amazing program that provides discounted rates on some fertility preservation options. Then we also have additional resources. LiveStrong has a whole AYA podcast series. They're video podcasts, and they talk about different topics. There's one on diet and exercise, body image, things like that. And the one that has the top views by a landslide is dating and sexuality. Surprise, this is something AYAs have questions about. And these work sort of like these videos. It's survivors sharing their experiences and sort of montaged together by topic or cluster. And then some of the emotional needs. Again, we have the video podcast where survivors just share the most amazing stories, talking about, as Joni touched on earlier, some of these fears, fear of recurrence, fear of dying. How do I talk to my friends and family about this? And then the Ullman Cancer Fund has an interactive guidebook called No Way It Can't Be, which is specifically designed for young adults. Something else. I think someone from Wonders and Warriors is here. Yes, hi. We also recognize that one of the unique characteristics of this age group is that they are more likely to be parents, and specifically parents of young children. And LiveStrong has partnered with WGBH, which is a public television station. They create Arthur, the aardvark cartoon. And we've worked with them to create a couple different resources, including a family activity booklet and a DVD titled When Someone You Know Has Cancer. And it's all about explaining and talking to very young children about when someone they love, as the name implies, when someone they love has cancer. And all those resources are available in English and Spanish, and everything's free, including the DVD and the booklets. And then some additional community resources. As we talked about, these feelings of isolation or feeling like you're the only one going through these different experiences can be really prevalent among AYAs. And so these are some groups that bring AYAs together for different experiences. First Descents is sort of like outward bound for AYA cancer survivors. They do rafting trips and I think a couple other things. There's a group in Canada that has started. It's like hiking in the wilderness. You can tell that's right up my alley. Like something about the wild, and I don't know exactly. One-on-one peer-to-peer support through Immerman Angels, which is a partner of the LiveStrong Cancer Navigation Services, the My Planet online chat rooms. And so that, again, was a whirlwind tour of just some of the resources that exist. And our another plug for the LiveStrong Cancer Navigation Services, they'll be able to connect you to all of these and more. And so our hopes for your takeaway, first of all, thank you all so much for coming tonight. We really appreciate it. I hope it's apparent that Joni and I are incredibly passionate about this subject and could talk about it for much longer if we had time or dinner. And we want to thank you all for coming. And again, we want to thank all of the survivors who participated in all the different videos and stories that we shared. We couldn't do this work without them. And our hopes for your takeaway, in addition to the 3 sort of textbook learning objectives at the beginning, really is that you've learned something here tonight, you feel moved to share it with someone, and that you're going to help us spread the word. That something happened tonight, that you heard something or experienced something that you feel like is unforgettable, and that you wanted to share it with someone else. So thank you very much, and we'd love to take your questions.
Well, first I want to encourage the in-person audience to come up to the microphone and ask a question if you have one. If you are you shy, just write it on a piece of paper and someone will come around and ask that. We have some questions from our at-home audience, which I'd like to ask you all. The first one is can you talk a little more about ways of empowering AYA patients? Then it wasn't too specific, but can you talk about ways of empowering AYA patients?
I think a great way to empower AYAs is really just to keep talking about the issue. And specifically, a great way to empower AYAs, I'm a big fan of role-playing. By saying to a healthcare professional, saying to an AYA or somebody else, you know what, you're going to go to your doctor's office. Let's just pretend like that's going to happen. And what are you going to talk about? Just pretend that I'm your physician or I'm your nurse. Tell me what's going on with you, and go that way. It really is a practical skill, learning to advocate for yourself, and so we do that through repetition and through learning, just like we do with all other aspects of education.
And I would say introduction of resources, and some of them, I think some of my favorite features in the LiveStrong guidebook are the pages that you can fill out ahead of time in the journal, where it's you're going to your doctor, what are the things you want to talk about, how do you feel today, and doing that. I feel a lot more empowered than anything. In fact, I was just at the slightly tangential, but I was just at the car dealership, something broke in my car, and I made sure that before I went in there, because I don't know anything about that, I feel way over my head, I'm afraid I'm going to be taken advantage of, I'm afraid I'm going to be upsold and spend too much money. So I made sure, even if it was just a Google search, to get my head around what was supposed to be going on, what I thought was going on, and how much money I wanted to spend, and I printed it out. And then when they said to me, this is what we think, I was like, well, could it be this? And that's just an example, sort of a metaphor for the same thing. Get your questions down ahead of time. Become comfortable with the things you want to ask. And remember, it's your time. And whether it's you talking to another survivor, or you talking to your healthcare team, or you talking to your insurance company, or feeling comfortable to ask for help to have those conversations, I always find if you can get some resources, sort of get your ducks in a row and become committed to, I'm not leaving here until I get this answer. And some of that just takes practice.
And I would say too, one last thing is that, one relationship with a critical healthcare provider can make all the difference. If you have a social worker who really listens to you, that frames your whole outlook for other healthcare professionals. And so healthcare professionals need to be really, keened in on the AYA population to say, I can really influence the way they advocate for themselves. I'm really going to focus on our relationship, and it's going to be a trusted one, so that future relationships, you feel comfortable having these conversations with others, even though I may not be there with you.
That was actually a perfect segue for before I was going to ask this next question, is that we have a team of licensed social workers who we call emotional support counselors, who they're all about empowerment and helping people to problem solve and find solutions in their life. So this next question was, is our cancer diagnosis or history of cancer something we should have to disclose to prospective employers?
Absolutely not. It is actually illegal for someone to ask you in an interview or on an application about your health history. Now, if you are going for a job that has physical requirements and you get through the interview process and you have to have like an occupational health physical, that's probably a moment that you might want to think about disclosing that information to the occupational health team. Are you going to be able to physically do the components of the job? But that's a very personal decision, and you don't have to disclose that to a prospective employer at all. Another great organization is Cancer and Careers. They have really good advice on how to do interviews and how to explain, for example, large gaps in your application, in your resume. Someone who's interviewing may ask, tell me what you were doing between 2002 and 2004. I see you weren't employed during that time. What was going on? Cancer and Careers has really great advice on how to answer those questions. You don't have to disclose Well, I was, getting chemo during that time, and I couldn't work. You don't have to say that at all.
Could you tell us more about the AYA support group and planning group that y'all have going on?
Hey, perfect. I was like, right here?
Take it away.
Yes.
So I intended to talk about this later on, but here in Austin, we're starting a planning group of specifically for people between the ages of 15 and 39, and we want to start doing more. That was going to be my big plug at the very end of this, was just, and we want to do more. There's some things going on right now, but we want to do some more. And so for those of you here in attendance in person, we have some sign-up sheets here and some more information about that. Those of you at home, please email us at cancer.navigation@livestrong.org, and we'd be happy to get you some more information about that. Any more questions? Folks, come on up. Don't be shy. Nobody? I have one more question from our home, and this will be our last question since we're at the end of our time. Are there any grants that young adults can apply for in order to do community outreach on this topic? Are there any grants that young adults can apply for in order to do community outreach on this topic?
I don't know about sort of financial stipends per se to do this kind of work. My recommendation would be sort of generally, and in response to this question, chances are there are organizations that already have printed and created or designed the resources that you might need to do community outreach work. So you may not need actual cash per se to start doing this work. You might want to look into a lot of the different organizations, and I would recommend the membership list of Critical Mass, which is available on their website, on the Critical Mass website. Look through that list of member organizations, learn more about those groups, and see if there's one that you feel like might be a good fit for you, and start volunteering with them. And then chances are they'll provide you with a lot of the resources and information that you need to then do that work, instead of trying to start from scratch.
And I don't specifically know of any grants either, but I would just reiterate, what Devin said, as well as, think about who your community is. There's an African proverb that says, if you want to go fast, go alone. If you want to go far, go together. So if you really want to make impact in your community, think about the organizations that are there in your community. Think about the physicians, the nurses, the social workers, the other adolescent and young adult survivors in the community. Bring everyone to the table, because you're going to go much farther together than you will alone. And chances are those other organizations have the financial resources and the human resources to help propel that movement forward. And if you're thinking about ways to really share this story and get people passionate about AYA oncology, share these videos. These videos are free at NOEP. You can get the missed video at livestrong.org. I had no clue about adolescent and young adult oncology until 5 years ago, when Heidi Adams, who works here at Livestrong now, told me her story. I had no clue as a nurse, and I thought, you know what? I can do a small little piece to help with this. And so it's just taking all of us doing our own little piece, doing what we do best, sharing our stories, and that's how we're making a difference. And that's how we're going to continue to make a difference. So look for the resources in your community, tap into them, leverage them, the business community, whoever it is, tell them the story.
Young children about when someone they love, as the name implies, when someone they love has cancer. And all those resources are available in English and Spanish, and everything's free, including the DVD and the booklets. And then some additional community resources. As we talked about, these feelings of isolation or feeling like you're the only one going through these different experiences can be really prevalent among AYAs. And so these are some groups that bring AYAs together for different experiences. First Descent is sort of like outward bound for AYA cancer survivors. They do rafting trips and I think a couple other things. There's a group in Canada that has started. It's like hiking in the wilderness. You can tell that's right up my alley. Like something about the wild, and I don't know exactly. One-on-one peer-to-peer support through Immerman Angels, which is a partner of the Livestrong Cancer Navigation Services, the My Planet online chat rooms. And so that, again, was a whirlwind tour of just some of the resources that exist. And our another plug for the Livestrong Cancer Navigation Services, they'll be able to connect you to all of these and more. And so our hopes for your takeaway, first of all, thank you all so much for coming tonight. We really appreciate it. I hope it's apparent that Joni and I are incredibly passionate about this subject and could talk about it for much longer if we had time or dinner. And we want to thank you all for coming. And again, we want to thank all of the survivors who participated in all the different videos and stories that we shared. We couldn't do this work without them. And our hopes for your takeaway, in addition to the 3 sort of textbook learning objectives at the beginning, really is that you've learned something here tonight, you feel moved to share it with someone, and that you're going to help us spread the word. That something happened tonight, that you heard something or experienced something that you feel like is unforgettable, and that you wanted to share it with someone else. So thank you very much, and we'd love to take your questions.
Well, first I want to encourage the in-person audience to come up to the microphone and ask a question if you have one. If you are you shy, just write it on a piece of paper and someone will come around and ask that. We have some questions from our at-home audience, which I'd like to ask you all. The first one is can you talk a little more about ways of empowering AYA patients? It wasn't too specific, but can you talk about ways of empowering AYA patients?
I think a great way to empower AYAs is really just to keep talking about the issue. And specifically, a great way to empower AYAs, I'm a big fan of role-playing. By saying to a healthcare professional, saying to an AYA or somebody else, you know what, you're going to go to your doctor's office. Let's just pretend like that's going to happen. And what are you going to talk about? Just pretend that I'm your physician or I'm your nurse. Tell me what's going on with you, and go that way. It really is a practical skill, learning to advocate for yourself, and so we do that through repetition and through learning, just like we do with all other aspects of education.
And I would say introduction of resources, and some of them, I think some of my favorite features in the LiveStrong guidebook are the pages that you can fill out ahead of time in the journal, where it's you're going to your doctor, what are the things you want to talk about, how do you feel today, and doing that. I feel a lot more empowered at anything. In fact, I was just at the slightly tangential, but I was just at the car dealership, something broke in my car, and I made sure that before I went in there, because I don't know anything about that, I feel way over my head, I'm afraid I'm going to be taken advantage of, I'm afraid I'm going to be upsold and spend too much money. So I made sure, even if it was just a Google search, to get my head around what was supposed to be going on, what I thought was going on, and how much money I wanted to spend, and I printed it out. And then when they said to me, this is what we think, I was like, well, could it be this? And that's just an example, sort of a metaphor for the same thing. Get your questions down ahead of time. Become comfortable with the things you want to ask. And remember, it's your time. And whether it's you talking to another survivor, or you talking to your healthcare team, or you talking to your insurance company, or feeling comfortable to ask for help to have those conversations, I always find if you can get some resources, sort of get your ducks in a row and become committed to, I'm not leaving here until I get this answer. And some of that just takes practice.
And I would say too, one last thing is that, one relationship with a critical healthcare provider can make all the difference. If you have a social worker who really listens to you, that frames your whole outlook for other healthcare professionals. And so healthcare professionals need to be really, keened in on the AYA population to say, I can really influence the way they advocate for themselves. I'm really going to focus on our relationship, and it's going to be a trusted one, so that future relationships, you feel comfortable having these conversations with others, even though I may not be there with you.
That was actually a perfect segue for before I was going to ask this next question, is that we have a team of licensed social workers who we call emotional support counselors, who they're all about empowerment and helping people to problem solve and find solutions in their life. So this next question was, is our cancer diagnosis or history of cancer something we should have to disclose to prospective employers?
Absolutely not. It is actually illegal for someone to ask you in an interview or on an application about your health history. Now, if you are going for a job that has physical requirements and you get through the interview process and you have to have like an occupational health physical, that's probably a moment that you might want to think about disclosing that information to the occupational health team. Are you going to be able to physically do the components of the job? But that's a very personal decision, and you don't have to disclose that to a prospective employer at all. You know, another great organization is Cancer and Careers. They have really good advice on how to do interviews and how to explain, for example, large gaps in your application, in your resume. You know, and someone who's interviewing may ask, you know, tell me what you were doing between 2002 and 2004. I see you weren't employed during that time. What was going on? Cancer and Careers has really great advice on how to answer those questions. You know, you don't have to disclose, well, I was, you know, getting chemo during that time and I couldn't work. You don't have to say that at all.
Could you tell us more about the AYA support group and planning group that y'all have going on?
Hey, perfect. I was like, right here? Take it away. Yes.
So I intended to talk about this later on, but here in Austin, we're starting a planning group of specifically for people between the ages of 15 and 39, and we want to start doing more. That was going to be my big plug at the very end of this, was just, and we want to do more. There's some things going on right now, but we want to do some more. And so for those of you here in attendance in person, we have some sign-up sheets here and some more information about that. Those of you at home, please email us at cancer.navigation@livestrong.org, and we'd be happy to get you some more information about that. Any more questions? Folks, come on up. Don't be shy. Nobody? I have one more question from our home, and this will be our last question since we're at the end of our time. Are there any grants that young adults can apply for in order to do community outreach on this topic? Are there any grants that young adults can apply for in order to do community outreach on this topic?
I don't know about sort of financial stipends per se to do this kind of work. My recommendation would be sort of generally, and in response to this question, chances are there are organizations that already have printed and created or designed the resources that you might need to do community outreach work. So you may not need actual cash per se to start doing this work. You might want to look into a lot of the different organizations, and I would recommend the membership list of Critical Mass, which is available on their website, on the Critical Mass website. Look through that list of member organizations, learn more about those groups, and see if there's one that you feel like might be a good fit for you, and start volunteering with them. And then chances are they'll provide you with a lot of the resources and information that you need to then do that work, instead of trying to start from scratch.
And I don't specifically know of any grants either, but I would just reiterate, you know, what Devin said, as well as, you know, think about who your community is. You know, there's an African proverb that says, if you want to go fast, go alone. If you want to go far, go together. So if you really want to make impact in your community, think about the organizations that are there in your community. Think about the physicians, the nurses, the social workers, the other adolescent and young adult survivors in the community. Bring everyone to the table, because you're going to go much farther together than you will alone. And chances are those other organizations have the financial resources and the human resources to help propel that movement forward. And you know, if you're thinking about ways to really share this story and get people passionate about AYA oncology, share these videos. These videos are free at NOEP. You can get the missed video at LiveStrong.org. You know, I had no clue about adolescent and young adult oncology until 5 years ago, when Heidi Adams, who works here at LiveStrong now, told me her story. I had no clue as a nurse, and I thought, you know what? I can do a small little piece to help with this. And so it's just taking all of us doing our own little piece, doing what we do best, sharing our stories, and that's how we're making a difference. And that's how we're going to continue to make a difference. So look for the resources in your community, tap into them, leverage them, the business community, whoever it is, tell them the story.